The 14-year-old Moti Dachasa is one of the many young Ethiopians who lost their sight due to cornea blindness. Recent studies ascertain that there are over 1 million visually impaired people across Ethiopia, and more than 300,000 of them are victims of cornea blindness. A cornea is a front circular and transparent part of an eye with 11 to 12 millimeter diameter. When this part of the eye gets scared, a person is said to be suffering from cornea blindness on condition that other parts of the eye are healthy and well functioning. The reporter of this program approached Moti Dachasa at the Eye Bank of Ethiopia located on the premises of Menelik II Hospital. Moti is going to get his cornea transplanted by Dr. Menon Ayale, one of the 6 Ethiopian surgeons who perform cornea transplantation.
አይኔን አሞኝ ነው የመጣሁትና ኦፕሬሽን ልደረግ
I'm here to get my eye cured through surgical operation. I've faced lots of problems. I had difficulties to read from notebooks. I often fell down during playing with my friends. I have to copy lessons at schools from my friend because I cannot see what is written on the blackboard.
በ5 ዓመቱ ነው የጀመረው በጣም ያሰቃየኝ ነበር ያሳክከዋል በጣም እየደከመ መጣ
He has been suffering from the eye ill starting from his age of 5. Since then his vision declined. I took him to different hospitals but no avail. He cannot see completely when darkness falls.
Established in 2003 with tripartite agreement of the Ministry of Health, Orbis International Ethiopia and Region 14 Health Bureau, the Eye Bank of Ethiopia is engaged in the collection and distribution of corneas to the society. Accredited by the Eye and Tissue Bank of International Federation, the Eye Bank of Ethiopia is commissioned loads of activities ranging from recovering corneas from dead persons who pledge their corneas before death to restoring of the sight of those persons suffering from cornea blindness. The capacity of cornea and external eye surgeon, medical director of the Eye Bank, Dr. Menon Chains, diseased corneas of blind with healthy and clean corneas. First she speaks causes of cornea blindness.
The cornea is affected by so many causes. The most common cause in our country, according to the study which was done in 2006-2007, is mostly infection, the most important being trachoma. Trachoma, as you know, is very common in our country. It's the leading cause of blindness in our country, and if not treated properly, it can lead to corneal opacity, which eventually leads to blindness. So infection in general is the commonest cause. Then the other common cause would be for us trauma, and there is also corneal opacity related to some other diseases, like for example vitamin A deficiency is also one other common cause in our country.
A national survey conducted in 2006 and 7 revealed that trachoma is the leading cause of cornea blindness in Ethiopia. As to Dr. Menon, most infections, including trachoma, can be prevented by having good hygiene and environmental sanitation. As an infection, a cornea can also be scarred from work-related trauma, such as exposure to flying piece of metal and wood. Hence, Dr. Menon advises technicians like welders to use protective eyewear as they perform their work.
With the support of different partners, stakeholders, the Ministry of Health is trying to establish a corneal donation for those people who are being affected. The problem with cornea is it's not, unless you replace it, it will not be functioning. It's not easily treatable problem. So the solution is, people should donate the cornea whenever they die.
After officially launched in 2003, many individuals have pledged their corneas to the bank, and the bank has so far received the consent of more than 7,000 individuals who are willing to donate their corneas upon their death. The process of acquiring corneas remains to be difficult for the iBank due to various problems.
The process of getting a single cornea is very long, because one, it starts from pledgers. You need to have pledgers of cornea. Then once you get your pledgers, they are registered, they have their IDs, and then when those people die, because everybody is informed when they have their IDs, they are told to inform their families. They have their IDs with them in case anything happens to them. Whoever gets that body knows that they are pledgers.
The iBank distributes IDs to individuals who pledge their corneas after death. Since ID, immediate family members of the dead or health professionals notify the iBank about the passing away of the pledger. Then technicians of the iBank procure the cornea from the dead body of the pledger as quickly as possible. After it's recovered, the cornea will be tested that it is 100% free from any transmittable disease, and the testing is carried out with the assistance of high-tech medical machines and equipment in the laboratory of the iBank.
In order to procure a cornea, there are several aseptic techniques that they have to follow. And besides procuring the cornea, they have also to take a blood sample from the donor in order to make sure that the donor is free of transmissible diseases like HIV, syphilis, hepatitis B and C, because we don't want to transmit those infections to whoever is getting those corneas. And then, as I said, they will follow aseptic techniques. They have to clean the donor's eye, the ocular surface, and then they will just take only 14 millimeter tissue from the eye. When we talk about procurement, it's not the whole globe that we are taking. We are taking just 14 millimeter tissue. I'm saying this because so many people, when we ask them to donate their eyes, they will get scared very much. They will imagine their eyes being taken out, and then it becomes very scary to them.
The recovered tissue will be placed in preservative chemical called Optizol. As to Dr. Manin, Optizol keeps the cornea suitable for transplantation for up to 14 days.
Once we make sure that that sample is free, we will just examine this cornea again under another microscope, which will enable us to see how much fit this tissue would be to the recipient. Okay, before transplanting it, we have to see that the cornea is really clear, that it's free of any disease, that it has adequate number of cells to keep it pumping and live in the recipient.
The Ethiopian iBank provides cornea tissue for transplantation services in Mekelle, Gondar, Hawaasa and Addis Ababa, and recovered corneas have varying qualities regardless of age differences.
Regarding the quality of the cornea, there is a standard where we make sure that the number of cells we have in the cornea is adequate to be transplanted. And as I have said, the cornea has to be clear. It should have no disease process going on. We make sure that it's free of any opacity or disease process before we say that it's fit for transplantation. So every tissue that is distributed is free of any pathology. We make sure that before we distribute it.
The bank makes use of corneas recovered from dead persons with age limit between 5 years to 70 years old. Corneas of dead persons whose age jumps over 70 years can also be used as long as it meets the desired quality. Since its inception in 2003, the bank has managed to provide corneas for 762 individuals and helped them to regain their sight. One of them is Moti Dachasa.
Before I entered into the operation room, I was somehow frightened, but once the operation started, it was good. I felt no pain. The operation took 2 hours. When gauze was removed from eye, I was able to see very clearly. Unlike the past, I had no problem to see in home and be able to read direct from the blackboard.
ቀዶ ጥገና ከተደረገለት ሁሉ በጣም ቆንጆ ነው። ትምህርት ቤትም አስቸግሮም በጣም እያነበበ ነው።
After he got transplantation, he sees well. It is nice. Now he can read well. I want to thank the government and staff of the iBank.
Before the iBank came into existence, Ethiopians with cornea blindness were required to go abroad and used to spend up to $3,000 to get one cornea from donors in other countries. Importing corneas was expensive and unaffordable. At the beginning of the bank was providing the service for free. Nowadays, however, patients are required to cover a small portion of the processing fee. According to Petros Kidane, acting medical director with the ministry, the iBank is working with various stakeholders to address its range of problems, including budget constraints.
We are working as hand in gloves with Addis Ababa city administrative health bureaus, with hospital and with other donors, with partners. So it's because of this collaboration that this is becoming a real activity in Ethiopia. So I think we need to strengthen, though we are facing problems on different directions, but still we are working together, and the ministry is supporting as well as partners are supporting. The Addis Ababa Health Bureau is also supporting for this bank. So I can say that we are in a good position, but a lot has to be done when you compare with the other healthcare services.
In a country like Ethiopia, where citizens provide due respect to deceased persons, it's difficult to procure corneas from a dead person with the consent of their family members. Hence, intensive promotion will be needed to collect as many corneas as possible before the corneas of the dead get buried.
We need to promote it, and we need to aware the people, not only using the medias, but different other means. It's like we have public forum whenever we conduct meeting on hospital services. We have public forums. We need to aware them. We need to produce that such sort of awareness for the people as well. And the other is, it's not only the public that's having shortage of awareness on this service. Even the health professionals should be aware of that. They may have the awareness that such types of intervention could be done, but they have to know that Ethiopia is just working on it, and it's providing service as well.
Now Moti has got a clean and a healthy cornea. Not only his sight are restored, but also his health and happiness.
I am very happy. I am thankful to the doctors here. I had a vision to be an engineer. Now I have changed my mind. Rather, I want to be ophthalmologist and cure those people suffering from eye illness.